and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
We're not starting a new fashion trend here, but Brad, we're actually going to talk about top 3 shin splint stretches that you should do. And plus we're going to throw in a little bonus treatment.
Yeah, you better believe it.
All right, shin splints, that pain that you feel either on the inside or outside, these stretches are to kind of get both of them.
Right.
So generally the more typical one is on the inside, and for that one you would do these 2 stretches. Brad,
Okay.
we jump right into them.
So we're trying to stretch that, which muscle is it, Bob?
Well, the first one you're just trying to stretch the, the Achilles tendon, gastroc soleus.
Okay. Those muscles in the back.
Yeah, back. So he's keeping the knee straight on this one. You got this, Lonnie? So this is just a regular calf stretch you're doing.
And do not let your foot point out like this. It's going to be a much better stretch if you get the foot pointing straight ahead towards the wall or the cupboard, whatever you're leaning on.
Good 30 seconds to a minute.
Yeah.
I stretch this actually even longer than that, Brad, but I do mine off the step.
Sure.
All right, the next one, go right into number 2, and this is stretching the posterior tibialis, and this is the key one. This is because that's the one that tends to get you on if your shin splints are on the inside.
So the only difference is from a straight knee leading forward to a stretch is simply bend the knee.
He's bending the knee, keeping the heel on the floor.
Yep. You may have to shift to keep the heel on the floor.
And he's bending the knee, and you're stretching a slightly different muscle there, and that's a key one with shin splints.
And you will feel the difference between this and this. It's not real obvious, but it's subtle, but you'll feel it if you're in tune.
People who have shin splints, Brad, often when they do this, they feel that one more than someone else who doesn't have it. I mean, it generally does show. All right, the next one is if your shin splints are more on the outside here, on the anterior, or the front, what we call it. So what you're going to do with this one is you're actually going to sit on your feet basically, Brad. So your toes are pointed down.
Okay.
Are pointed out that way, right? And you're just going to lean back and stretch onto your feet.
Right, and you're probably going to do this on a carpeted floor.
Yeah, this is a kind of a cushion thing, so that works out real nice.
You could do it with or with shoes on or off. Probably shoes on, maybe a little more aggressive.
Yeah, I would say. This is giving a pretty good stretch right now.
So right now, the ankle's being pulled this way, stretching these muscles in the front.
Stretching the anterior tibialis. This is the one that my son had. This is the shin splints he had. All right, our bonus is we're using the massage track here.
Sure.
I'll put the title up on the board here, but the massage track, we've used this for other things. These are just kind of a hard ball, a lacrosse ball, I guess.
Right, for playing the game lacrosse, yep.
Yep, and they use these balls to help provide kind of an intense stretch.
That deep massage into that muscle.
Now, if you look at this tray, Lonnie, I don't know if you can see this, but on the outer ones here, there's not as much space between the balls as there is on the inner one here, where there's a little bit of a quarter inch, Brad?
Right, there's just a little more there, and that little bit can make a difference on this particular exercise.
So you either are going to use the balls, you'd use them on the outside like this, or on the inside. I use it on the inside. It seems to spread apart and be at the right width for me then.
So these balls are not going to be on the tibia or that shin bone.
Nope.
They're going to be on the muscle on each side.
Yeah, they're going to be on both sides like that.
Right, so they're pushing into the soft muscle belly.
Yeah, they're catching the muscle all the way down. And I'm going to work every half inch, and I'm going to hold it for like 12 to 60 seconds. That's their recommendation.
Sure.
So I put it right on the inside tray there, and I get right on it. And this is a stretch you can't really duplicate any other way, so I do like this. So I've got pressure on there. Like I said, I'm not going to sit for 60 seconds now, but after about 60 seconds, and you can move it down and go another 12 to 60 seconds.
Right, and if it's tender, you're going to have to adjust the amount of weight you put on.
Right, you can lean. I can lean right on it, or I can keep pressure off because I got one knee on here. So so you can keep moving along. You can start it this way actually, Brad, and move it along a lot easier that way.
Right. So the idea is not to roll it back and forth.
No, I'm
but
not
it's
rolling back and forth. I'm just putting, a static pressure on it.
straight down, hold for 12 to 60 seconds. And typically, as it improves, you can hold longer because it's not as sore. The idea is that you're going to do a deep soft tissue massage to relax
Almost
the
a
muscle.
release.
Yep.
Yeah.
Release that tension in the muscle, improve circulation, which improves healing.
We've done another video on this where you can use this almost on any part of the body.
Right,
I mean,
yep.
they got it up in the neck.
Yep, the back,
Yep.
hamstrings,
Right.
quads.
So kind of a cool product.
But we don't have to get into that right now, Bob.
All right. Well, I can put a video link up to it though.
Sure.
So,
All right.
all right. Thanks for watching.